Live at 5, impacts of the government shutdown. Locally, how is it making an impact? Thanks for joining us. I'm Jessica Bowman. It's been 8 days since the federal shutdown. As it continues, how does this impact local services? KTIV's Taylor Deckard spoke with Siouxland District Health officials today on the changes at the federal level and what it means locally. So Taylor, what did you find out today?
Let's start by taking a look at this here behind me. On October 1st, the Iowa Health and Human Services posted this alert banner, and it says very bluntly, no impact on services. Now, the state says it's supporting services for Iowans at this time, and the Siouxland District Health Director says that statement stands true. Health Director Kevin Grime addressed the Siouxland District Board of Health that things are under control for now. The Iowa State Medical Director brought public health providers from across the state for a monthly statewide call earlier this week. He said the good news is Iowa has a general reserve fund and there are reserves available in the state to continue the services so it doesn't interrupt for the clients. There are 3 programs locally that the community is keeping a watchful eye on. The personal care program, WIC, which is the nutrition program for women, infants, and children, and certain child health services like the I Smile program. Now, for the most part, the government operates on a reimbursement model.
So these are all considered grant funds, 3 different grant funds that come with us. And even in the interim, if we're not able to bill those expenses to that grant, once the funding is restored, then we can submit all those expenses back to be reimbursed.
This is not the first major shutdown. The last one happened in 2019, and the health district operated the same way. According to Grime said that WIC currently serves over 3,000 clients per month, and he encourages families to keep appointments or call the department if you have any questions.
So that's why there are also some rebates they receive from some of the formula contracts and that will help fund this. And then lastly, in some cases, there are still some federal funding they're able to access. So they basically gave us the reassurance to say, continue business as usual, and that's what we plan to do.
He said he wanted to bring it to the board's attention now that this is being monitored, and if the shutdown were to continue into November, they've got it taken care of. So what is next? As he said, business as usual, and he said when these situations arise together, they are navigating it as well as possible. Jessica?
All right, KTIV's Taylor Deckard live.